So imagine waking up from a really complex knee surgery. Like you had severe osteoarthritis, right?
Right, the kind where it hurts to just walk or, take the stairs.
Exactly.
Right.
But after the operation, the pain is just gone. You spend 2 whole years walking perfectly, living your life, totally convinced the surgeon fixed the damage.
Yeah.
And then your doctor sits you down and tells you that they never actually did the surgery.
They just cut your skin, splashed some water around, and sewed you back up.
It's insane.
It sounds like a massive medical malpractice lawsuit just waiting to happen, but it's actually one of the most profound scientific discoveries of the last few decades.
Well, welcome to today's deep dive. We are looking at a really massive stack of sources today.
We really are.
Yeah, covering everything from like historical medical journals and modern neurobiology studies
Mhm.
to actual clinical trial guidelines.
Mhm.
And we're on a mission to answer a question that you've probably wondered about yourself.
Right, like every time you pop an ibuprofen for a headache.
Exactly. The question is, how can you tell real medical benefit from the placebo effect?
For a very long time, medical science viewed the placebo effect as just, well, as a nuisance.
Just noise in the data.
Exactly. It was treated as statistical noise, like a trick of the mind that needed to be weeded out so researchers could see what the real drug was actually doing.
Right.
But as we dig into modern neuroscience, this really profound paradox emerges. The placebo effect isn't a fake benefit at all.
No, not at all.
It is a very real, highly measurable biological response.
So to figure out how to separate a biological placebo response from the actual mechanics of a drug, we first have to look at how science officially draws that line.
And that brings us to the gold standard of testing, which is the double-blind randomized controlled trial, or RCT.
Right, the RCT.
Yeah, it's the foundation of modern medicine. You basically take two groups of patients.
Yeah.
One group gets the active drug, and the other gets an identical but biologically inert substance.
The placebo.
Exactly, the placebo. And by keeping both the patients and the doctors blind to who is receiving what, you strip away all those extra variables.
Right, so you remove the patient's psychological expectations.
Yes, and you account for the natural healing course of the disease itself.
Because sometimes people just get better anyway.
Exactly. And you also neutralize the therapeutic ritual of just being cared for by a medical professional.
Okay, let's unpack this for a second. A placebo-controlled trial is essentially, it's like a high-stakes scientific taste test.
Oh, I like that analogy.
Yeah, like you don't just blindfold the judge. You serve the generic soda and the super expensive brand name soda on the exact same silver platter.
Poured by the exact same waiter, yeah.
Right. You want to make sure the judge isn't influenced by the fancy logo or the price tag, so you completely isolate the pure taste. Or, in a trial, the pure mechanical effect of the intervention.
And when you actually isolate that mechanical effect, the results routinely upend everything we think we know about healing.
Which brings us back to the knee surgery.
Right, that scenario you described at the start, that was a real study from 2002, led by Dr. Bruce Moseley.
The details of this knee osteoarthritis study are just mind-blowing.
They really are. They took patients with severe, debilitating knee pain and brought them into the operating room.
For the active group, they did a real arthroscopic surgery, right? Like physically clearing out the damaged tissue.
Exactly. But for the placebo group, they administered a sham surgery. They put the patients to sleep, made 3 small incisions in the skin.
They even played audio recordings of surgical equipment.
Yes. So if the patients were partially awake, they'd hear the sounds of a real surgery. But they didn't fix a single thing inside the knee joint.
And the results.
Over the next 24 months, the data showed that the pain and function outcomes for the sham surgery group were completely identical to those who had the real tissue removed.
2 entire years of identical pain relief from a surgery that literally never happened.
Yeah, and this isn't even a new phenomenon. Our sources point out this historical heart surgery from 1939.
Oh, right, the Fieschi surgery.
Yes, the Fieschi internal mammary artery ligation. It was hugely popular for treating angina. Surgeons swore by it.
Until they actually tested it.
Right. In 1959, they finally did a sham-controlled trial and proved it was absolutely no more effective than a placebo. The surgery did mechanically nothing for the heart.
And we're still seeing this today. I mean, look at modern gynecology and the sources. The fractional CO2 laser therapy for genitourinary syndrome of menopause.
GSM, yeah, or vaginal atrophy.
Right. early on, it seemed totally revolutionary. Everyone thought it was a game changer,
But recent sham-controlled trials have actually suggested that the benefits for these postmenopausal women might just be a massive placebo effect.
which just proves why these RCTs are absolutely necessary.
Absolutely.
But here's where it gets really interesting for me. I'm struggling to picture this. Like, if my knee is bone on bone, no amount of positive thinking sews that cartilage back together.
No, it doesn't.
So how is the pain physically stopping? If an inert sugar pill or a fake surgery makes my pain go away for 2 years, isn't the benefit actually real? Like, why do we call it fake?
And that is the ultimate tension in this entire field. You're right, the cartilage isn't growing back, the mechanical structure of the knee hasn't changed one bit,
Okay.
but the biology of the pain has changed.
How so?
Well, for a long time, doctors assumed patients in these trials were just, I don't know, politely reporting that they felt better to please the researcher.
Oh, like people pleasing the doctor.
Yeah, or just experiencing a temporary shift in mood. But modern brain imaging technology has completely disproven that. When you experience a placebo effect, your brain actively alters your physical state.
So it's not just a subjective attitude shift.
Far from it. The sources detail a very specific neural pathway that activates when you genuinely believe you are being healed.
Okay, walk me through it.
It starts in a region of the brain called the rostral anterior cingulate cortex, or the RACC.
The RACC, got it.
This area heavily processes expectations, emotions, and pain. When you firmly believe you've just received a really powerful treatment, the RACC just lights up.
Like it gets triggered by the belief.
Exactly. Think of the RACC as a high-ranking military general. It immediately sends a signal down to the troops in the brainstem,
Which troops?
specifically the pontine nucleus and the cerebellum. And then they send orders straight down to the border wall, which is your spinal cord.
Okay, and what does the spinal cord do?
They effectively tell the spinal cord to close the gates, to physically block the pain signals traveling up from your knee from ever reaching your conscious brain.
Wow, so the brain is basically acting as its own pharmacy, just manufacturing its own painkillers.
Yes. And we actually know exactly which drugs the brain's pharmacy is dispensing. When you anticipate relief, your brain releases its own endogenous opioids.
Endogenous meaning made inside the body, like endorphins.
Exactly, natural painkillers. And researchers proved this using a drug called naloxone.
Wait, naloxone, isn't that what paramedics use to reverse opioid overdoses?
That's the one. It actively blocks the brain's opioid receptors.
Okay, so how do they use it with placebos?
Scientists induced a strong placebo pain relief effect in patients. The patients reported significant pain reduction. Then, researchers secretly administered naloxone without the patients knowing.
Oh, wow. And what happened?
The placebo effect vanished instantly. The pain came rushing right back.
That is wild. So if an overdose drug stops a placebo effect, that proves the placebo wasn't just a change in mood. It was literally driven by the brain's own physical opioids.
Exactly. But the brain's internal pharmacy is vastly more sophisticated than just dispensing generic endorphins.
Really?
Yeah. The sources highlight this incredible exception involving other types of painkillers. Like, if a patient is consistently conditioned with non-opioid drugs.
Like NSAIDs, ibuprofen, aspirin, stuff like that.
Yes. If they use those and then you later switch them to a placebo without their knowledge, the brain actually doesn't release opioids.
Wait, so what does it release instead?
The placebo effect in those patients is driven by the endocannabinoid system instead, specifically the CB1 receptors.
You're kidding.
No. The brain literally remembers the specific chemical pathway of the ibuprofen it thinks it's getting, and it mimics that exact biochemical pathway.
It actually manufactures a bespoke knockoff version of the drug.
Yes.
That completely changes how I view my own body. It's not just a generic feel-good wave. It's targeted chemical mimicry.
It really is, and the sources show this extends way beyond just pain management. Just look at the Parkinson's disease studies.
Right, Parkinson's, that's fundamentally a lack of dopamine in the brain, right?
Right.
Which causes those severe motor tremors and rigidity.
Exactly. Which means a placebo response in a Parkinson's patient would require the brain to somehow manufacture actual dopamine.
And that is exactly what happened. In these trials, researchers took Parkinson's patients and performed sham surgeries.
Right. They drilled burr holes into their skulls but didn't actually perform the deep brain stimulation or implant any cells.
But because the patients woke up expecting a massive improvement in their motor control, their brains released a huge wave of dopamine in the striatum.
The expectation alone physically altered the firing rate of neurons in their basal ganglia. their tremors visibly reduced.
It's just unbelievable. But if the brain has this fully stocked internal pharmacy capable of synthesizing dopamine and bespoke painkillers,
Hmm.
what actually writes the prescription?
That's the million-dollar question. Because the sugar pill itself is biologically inert. The surgical scalpel that only cuts the skin doesn't contain medicine.
So it's the meaning we attach to those things. We are basically talking about classical conditioning.
Exactly.
This is just Pavlov's dogs. Like Pavlov rings a bell, gives the dog food, and the dog drools. Repeat it enough, and eventually he just rings the bell and the dog drools, even when there is no food.
We are constantly being conditioned by the medical system in the exact same way.
So what does this all mean for us? For us, the bell is the doctor's white coat. The bell is the smell of the rubbing alcohol in the clinic, the sharp beep of the hospital monitor.
Even the shape of a capsule.
Right. Our brains have learned over a lifetime to associate those specific environmental cues with healing. So when we encounter them, our brain hears the bell and we start drooling endorphins and dopamine.
And because the response relies entirely on context and meaning, researchers have found that tweaking the physical presentation of a treatment drastically alters the biological response.
So the details actually matter.
They matter immensely. Take the color of the pills, for example. Our sources showed that red placebo pills act as stimulants.
Wait, really? Red sugar pills speed up your heart rate.
Yes, people take a red sugar pill and their heart rates actually speed up, but give them a blue placebo pill and it acts as a depressant. It helps them sleep.
That is so deeply ingrained in us.
And the price tag changes the biology, too. If you give a patient a placebo and tell them it costs $2, they experience a baseline level of pain relief.
Okay.
But if you give them the exact same placebo, but frame it as a revolutionary new pharmaceutical that costs $50 a pill, they produce significantly more analgesia.
Because the brain equates high cost with high value.
Exactly. It thinks, this is expensive, it must work, and it turns up the dial on the internal pharmacy.
Which brings us to the ultimate trigger. If the brain is reacting to the drama of the ritual, the price tags, and the colors, then a massive surgical procedure must send the brain into absolute overdrive.
It does. It's what the literature calls the mega placebo.
The mega placebo.
Invasive procedures have an inherent hierarchy of meaning. An injection has a stronger placebo effect than a pill because a needle breaking the skin feels more serious.
Right, it demands more attention.
And a giant complex medical device has a stronger effect than an injection. And surgery is the undisputed king of the mega placebo.
Because the ritual is undeniable. You have to fast for 12 hours. You strip down, put on a hospital gown, you are wheeled down a cold hallway under bright fluorescent lights.
A team of highly trained professionals in masks hovers over you.
The sheer drama and gravity of that ritual convinces the deepest parts of your brain that something profound has just occurred, which triggers a massive biological healing response.
But, exploring the power of expectation forces us to look at the other side of the coin.
The dark side.
Yeah.
Mhm.
If positive expectations and elaborate rituals release dopamine and opioids to heal us, what happens when a patient is terrified?
Or when they deeply expect a treatment to hurt them.
Exactly. We get the nocebo effect.
The evil twin.
Right, the nocebo effect is just as biologically potent. If a patient is highly anxious or deeply expects severe side effects, that negative expectation activates an entirely different chemical pathway.
So it's not opioids this time.
No. Instead of opioids, the brain triggers the release of a peptide called cholecystokinin, or CCK.
I'm guessing CCK doesn't shut the pain gates.
It does the exact opposite. CCK actively amplifies pain. It turns the volume up on the pain signals traveling through the nervous system. If you give someone a sugar pill and warn them that it has a high likelihood of causing a terrible headache and severe nausea,
A bunch of them will actually get a headache and nausea.
yes, a significant percentage will physically develop those exact symptoms. They manifest the side effects they expect because the anxiety triggers the corresponding biological distress.
This has massive, real-world clinical implications. I mean, I'm looking at the UK's General Medical Council guidelines for cosmetic interventions from our sources.
Right, the GMC guidelines.
They have explicitly updated their rules to require doctors to deeply explore a patient's psychological expectations before they ever pick up a scalpel.
It's a crucial step.
They have to secure highly informed consent regarding the emotional outcome of the procedure.
And that isn't just bureaucratic red tape or legal cover, it's biology.
Exactly. If a patient has unmanaged expectations, like if they secretly believe a nose job is going to magically fix their failing marriage or cure their clinical depression.
Which it obviously won't.
Right. And when the surgery doesn't achieve that impossible goal, the resulting disappointment can trigger a severe nocebo-like physical and psychological dissatisfaction.
The patient might claim the surgery is botched or that they are in chronic pain, even if the surgeon did a mechanically flawless job on the tissue.
So the doctor's words, their tone of voice, the way they frame the risks, it all acts as a biological intervention.
It does. But this creates a staggering dilemma for modern medicine.
Yeah, an ethical one.
Right. If a doctor knows that a sugar pill or a sham surgery might actually cure your chronic back pain because of the placebo effect, are they ethically obligated to lie to you to trigger it?
Is deception a medical necessity? This raises an incredibly practical question for you, the listener.
Definitely.
If I know I'm taking a placebo, does the whole illusion fall apart? Like, can I hack my own brain without being tricked?
For decades, the medical establishment assumed deception was the secret ingredient. They assumed if the patient knew, the magic just vanished.
Makes sense.
But recent research has uncovered one of the most exciting developments in this entire field: open-label placebos.
Open label meaning no secrets, no deception.
No deception whatsoever.
Mhm.
There is a landmark study cited in our stack led by Dr. Carvalho focusing on patients with chronic lower back pain.
Okay.
These were patients who had been suffering for a long time, often cycling through various failed treatments. The researchers brought them in and literally handed them prescription bottles clearly labeled placebo pills.
Wait, they straight up told them these are inert sugar pills.
They did.
How does a patient even reconcile that? Why would they bother taking them?
Because the doctors didn't just hand them the bottle and walk away. They spent time educating the patients. They explained the exact science we've been discussing today.
Oh, so they told them about the classical conditioning.
Exactly. They told the patients that placebos can trigger a Pavlovian mind-body healing response. They explained that a positive attitude helps, but isn't strictly necessary. The body's conditioning can take over regardless.
Okay, so what do they tell them to do?
They instructed them to take the pills faithfully, twice a day, to engage the ritual.
So they initiate the physical ritual of taking medicine, but entirely remove the lie. And did it work?
The data from the open-label placebo group showed a 30% reduction in both pain and disability.
30%.
Yes. That matches, and in some cases completely beats, the relief you would get from standard, heavy medical treatments for chronic lower back pain.
Just by going through the physical motions of unscrewing the cap, swallowing the pill, and understanding that the brain has the power to heal itself, the internal pharmacy opens for business.
You don't have to be tricked. You just have to participate in the context.
That is amazing.
But, the data also shows that not everyone responds to this ritual with the same intensity. And that brings us to the cutting edge of current placebo research,
Which is
a concept known as the placebome.
the placebo, like the human genome or the microbiome.
Exactly like that. Genetic and transcriptomic studies are revealing that our individual capacity to respond to context and meaning is actually written into our DNA.
Wait, really?
Yeah. Researchers have identified variations in genes related to our dopamine, serotonin, and opioid receptors. Specifically, genes with names like FAAH or COMT.
FAAH and COMT.
Right. These genetic variations dictate the efficiency of your internal pharmacy.
So some of us are literally genetically hardwired to heal ourselves better through context and ritual.
Yes. Your specific genetic makeup might mean your brain is uniquely primed to flood your nervous system with endorphins the second a doctor in a white coat walks into the room and gives you a reassuring smile.
So you'd be a high responder.
Exactly. Meanwhile, someone else with a different variation of the COMT gene might need a much higher dose of actual pharmacological intervention simply because their internal pharmacy doesn't stock the shelves the same way.
Or it just doesn't react as strongly to the bell of the medical environment.
Exactly.
We have covered a massive amount of ground today, from fake knee surgeries to the genetics of belief. Let's bring this all back to the core mission we started with.
Okay.
How do you tell real medical benefit from the placebo effect?
Well, if you are designing a clinical trial, you use double-blind randomization to aggressively separate them. You isolate a drug's mechanical properties to ensure the chemical itself actually does what it claims to do, independent of human belief.
You have to know the mechanics work.
Right.
But as a patient sitting in a clinic, You shouldn't want to separate them in your own treatment.
No, absolutely
You
not.
should be trying to strip away the placebo effect. The ultimate medical care isn't just swallowing a scientifically proven active ingredient in a cold, sterile vacuum.
No, the ultimate care combines that proven active ingredient with a highly optimized, supportive, and positive context.
You want the empathetic doctor. You want the reassuring ritual. You want the expectation of healing. Because that combination gives you the maximum possible benefit.
You get the drug's mechanics plus the bespoke painkillers from your own brain's pharmacy.
Exactly.
It requires us to completely reevaluate what we consider a treatment. And, it leaves us with a fascinating, slightly provocative thought to ponder.
What's that?
As we continue to map the genetics of the placebo, we are going to be able to accurately identify who is a high placebo responder.
Which sounds great until you think about the business of healthcare.
Exactly. Imagine a future where health insurance companies get access to your placebo data.
Oh, wow.
If an insurance company knows you are genetically hardwired to experience massive pain relief from medical rituals alone, could they refuse to pay for your expensive knee surgery?
That is a terrifying thought.
Could they institute a policy that requires you to undergo a cheaper, open-label sham surgery first, forcing you to try and heal yourself with your own brain before they approve the mechanical operation?
I mean, it sounds like science fiction, but the biology proves it might actually work.
It really might.
So the next time you get an X-ray and the doctor points to that jagged white line on the film, just remember, the physical mechanics of the body are only half the story.
Definitely.
The rest of the healing. That happens in the messy, brilliant, invisible space between your ears. Thanks for diving deep with us today.